Hello everyone, today I want to start by telling you the story of Daniel Michael Carter. Daniel Michael Carter was an emergency room physician, a doctor, who his peers sometimes used to call him Superman because he was a very hard-working doctor. You know, he was a doctor who attended to patients who were experiencing conditions of emergency. And so he worked in the emergency room, the ER, and he attended to all sorts of patients. He attended to gunshot wounds, he attended to victims of road traffic accidents, he attended to all sorts of illnesses, collapse, and all sorts of illnesses. And he was a very hard worker. So he spent hours upon hours, working, attending to patients, and his colleagues playfully used to call him the Superman. He had superpowers. And so he continued to work like this for a long period of time. But as he continued to do this, he from time to time used to experience symptoms that, even as a medical doctor, he felt that these symptoms showed that he was under immense stress. He pushed himself, and he was working 60 to 70 hours of work every week. And he kept pushing himself. His colleagues tried to warn him at times that perhaps he was doing too much work for himself. But he said, don't worry, I'm a medical doctor, I'm good at handling stress, and I know how to handle stress. And so he continued to work at this pace. Now, after a period of time, there was a particular morning he came into work, Daniel came into work, and he was working on a patient who had suffered a gunshot wound. And as he was with this patient in the operating theater, the patient was on the operating table. As he was with this patient on the operating table, he himself, that's Daniel Michael Carter himself, collapsed while he was conducting this operation. He collapsed, and he had to be rushed out of that theater into another theater, and then he had to be stabilized, and then medical history was taken, and he found out that Daniel was suffering from stress. He had overexerted himself over a long period of time, and his immune system was really not doing so well. He had contracted a viral infection, which was an airborne virus, which should normally have been taken care of by his immune system if he was in great shape. But because he had overexerted himself over a long period of time, and this stress had really gotten to him, and so this affected him, and he had to stay many weeks without attending to work, in convalescence. He had to be taken care of for a long period of time before he could regain his strength. So the question we would ask is, what is the effect that intense or stress, what's the effect of stress on the immune system? And that's what we're going to discuss in a couple of minutes today. What's the effect of stress on the immune system? Now, what is stress? Stress is the physiological response that the body gives to sustained activity. So when we sustain activity, now that activity, funny enough, is not only physical activity, it could even be mental activity. That's why you find people who are not doing so much, but who are thinking really deeply, can suffer from mental stress. So both physical, any type of sustained activity without adequate rest would lead to stress, and stress is the physiological response that the body gives to this kind of sustained activity for which there is no rest, whether it's physical activity or mental activity. Now the question is, how does stress affect the immune system? Now we'll discuss a little bit about physiology to give ourselves a preamble, to try to understand the effect that stress has on the immune system. Now the first thing to realize is that when there's sustained activity without enough rest, it leads to stress. And the body, before stress can occur, there are two pathways in the body through which you can begin to feel the effect of stress and the essence of stress. So stress is regulated by two major pathways in the body. There's the first pathway, which we call the HPA axis, and this is important. And also there's the second pathway, which is regulated by the sympathetic nervous system. Now we'll talk about the first pathway, which we call the HPA pathway, and the HPA means hypothalamus is for H, hypothalamus is for H, P is pituitary, adrenal axis. So hypothalamus, pituitary adrenal axis. Now this is the area of the brain that is affected by stress, and when we have this sustained activity without any rest, this part of the brain is overstimulated, and when it continues to be stimulated for a long period of time, it leads to the release of a particular hormone, and this hormone is called corticotrophic releasing hormone, corticotrophic releasing hormone. And this corticotrophic releasing hormone is a hormone that is released, in response to high sustained activity, in response to stress. And the release of this, now, in physiology is an interesting part of science where one hormone is released and it affects the release of another and another and another. So in this instance, you have this hypothalamus pituitary adrenal axis, and in this axis you have the release of your CRH, which is your corticotrophin releasing hormone. Now this hormone now leads to the stimulation of the production of another hormone, which we call the adenocorticotrophin hormone. Now this hormone also stimulates the pituitary gland, which is in the brain, to then release a chemical which we call cortisol. Now cortisol is an important chemical, and it is there because it has its own effect. And cortisol is a chemical that has anti-inflammatory effect, and the prolonged presence of cortisol has a way of overstimulating the immune system and leading to other complications. Now remember that I started this discourse by telling you that there are two pathways for stress. The second one is the one that is being regulated by the sympathetic nervous system, and when there is sustained activity over a long period of time without adequate rest, the sympathetic nervous system also goes into overdrive and then begins to produce two hormones, adrenaline and noradrenaline. So your cortisol, which is from the HPA axis, your adrenaline and your noradrenaline are all chemicals that are released by the body in response to stress, in response to sustained activity without rest. Now the question to now ask ourselves is that when you have this kind of stress, what is the effect that this stress has on the immune system? What's the effect that the production of these hormones have on the immune system? Now the first thing that this stress has, the first effect that stress has on the immune system is that it decreases the activity of the white blood cells. Now the white blood cells, your macrophages, your mast cells, dendritic cells, all these cells, when there is sustained amount of stress within the body, it weakens the activity of these white blood cells. And remember that these white blood cells are working over time, to fight against infections and keep us infection free. And so if there is a weakening of the strength of these white blood cells, overall it weakens the immune system, and the immune system is unable to function very well. Now chronic stress also leads to sustained inflammation. And remember we talked about inflammation some days ago, where we said that was the response of the body to injury. So if you have chronic stress, if you have stress over a long period of time, it reduces the ability of the body, and it leads to sustained inflammation. And this sustained inflammation means that the body continues to be in fight mode. It continues to behave as if it's fighting against pathogens, and so there's a continuous release of different types of chemicals. For an example, there's a continuous release of chemokines like our interleukin 6. Different types of chemokines continue to be released when this should stop. So you have the overstimulation of the immune system, you have the overstimulation of the inflammatory response. This is what stress can cause. Also, stress affects wound healing ability of the body. We have our fibrinogen, we have our collagen. These are all proteins that are involved in wound healing, blood clotting. So you realize that when there is sustained stress, it affects the ability of the body to release fibrinogen, to release collagen, and so it's really difficult for wound healing process to continue to take place within the body. And chronic stress can also lead to an increase in the risk of tumor, cancers. So continuous stress and continuous release of these hormones, that's adrenaline, non-adrenaline, and cortisol, can help to exacerbate cancer. And so you now have cells that are growing, and when you have cancer, what you're saying is that you have cells that are growing uncontrollably within the body and are refusing to differentiate. And so you have this mass of cells that are not useful to the body. And sometimes we realize that chronic stress also helps to push metastasis. So you have tumors that become malignant, and when they are malignant, you have them breaking away from one part of the body and going to another part of the body. So chronic stress can exacerbate cancers, can exacerbate tumors, and this is important for us to know. Now there are also different ways. We round off by saying that there are also different ways that we can use to try to reduce stress within the body. One of the ways is regular exercise. Regular exercise is important. If you exercise as regularly as possible, 30 minutes, maybe 30 minutes in a day, 3 times a week, it is a good way to try to reduce stress. Also, taking the intake of balanced diet is important. If your diet is very balanced with the right proportion and amount of nutrients that are needed, that is a very good way to try to reduce stress. Adequate sleep is also really important. In the fast-paced world where we are living, a lot of adults, their sleep is the sleep pattern is really affected, and it is important to try to get adequate sleep. 6 to 8 or 8 to 10 hours of good deep sleep that is not disrupted at some point in time can be very good. Also, there are meditation exercises. Those that like to do yoga, those that like to do other kinds of meditation, this is also useful to help to reduce stress. So thank you for listening to this video. I hope you've been able to gain 1 or 2 things. NEPA have done what they usually do. Thank you for listening and have a wonderful day.